Good morning, everybody. Welcome to Breakfast. Thank you for joining us today. The programme with Sally Nugent and John Kay.
Now, health officials are investigating the first human case of a new strain of swine flu in the UK. The infection was detected in a routine flu screening test at a GP surgery in North Yorkshire. Officials
said that this person had respiratory symptoms, a mild illness, but has now fully recovered. There's lots about this in the papers this morning, so we thought we'd check in with Dr. Helen Wall, who can try and explain a bit more to us. So I guess the first question is, should we be worried?
I don't think we should be overly worried about this. I think this is another variant of flu. We're going to have different variants of all viruses coming through. It's great that it's been picked up because it means that the UK Health Security Agency, the public health body, can now investigate, make sure that it isn't anything to be worried about. All of that's ongoing, but at the minute I think we just need to carry on and use the normal precautions that we would have if we've got flu.
So, how does swine flu differ from the flu that we know?
Essentially, everything, all flu is potentially serious. So we can't say, swine flu is more serious, less serious. We don't know what this new variant is. It's not been detected in humans in the UK before. It's circulating in pigs. We know that. There's been 50 other such variants that circulate in pigs since 2005 detected in the UK. This is just the next one. There's lots of investigations now will be going on to find out exactly, is it more transmissible? Is it more serious? We don't know, but essentially the symptoms we think are pretty much the same. This person who was detected, it was a spot test, it was pure fluke that it was picked up, but through the surveillance that's done to look at the different variants going around the UK. And, this person had a mild illness and recovered well. And that's the same for any flu. It can be relatively straightforward, although obviously you'll feel really, really sick, or you can become very severely unwell with any flu and go into hospital, which is why we want people to be vaccinated for flu every year.
It's interesting that it was picked up in a routine, a sort of random spot test, because I guess that means there's almost inevitably quite a lot of other cases out there.
We're all walking around with a number of germs, viruses, bugs in us that we don't know about on any given day. This was picked up, as you say, in a surveillance situation. So the UK Health Security Agency will sign up various GP practices amongst lots of other surveillance activity that they do. One thing they do is they ask certain GP practices to sign up and spot test patients who present with respiratory symptoms, and that's what's happened here. This patient's turned up with your normal respiratory symptoms that could have been anything from COVID to flu to your common cold, and has had a test just to check what's going on, really. We wouldn't do that routinely in general practice, so we certainly wouldn't expect to see lots of people coming forwards for testing for swine flu in general practice. And I think it's important that I say that today, because that's not going to happen. Even for flu, we wouldn't routinely test patients if they remain well enough to be at home. Obviously, if they go into hospital, that's different. They would often then get tested for COVID and flu if they have the right symptoms.
And in terms of symptoms, not swine flu, but in terms of flu symptoms, at what point should people speak to their doctor?
Flu makes you feel really, really poorly, and I see lots of patients that think they've got flu and, they are poorly, but they're generally up and about and getting on with things. Flu tends to make you feel like you need to go to bed. You've got aches, chills, fevers, cough, cold symptoms, and just feel really, really drained. I think the key thing is, there's lots of good advice on the NHS website about flu symptoms, so follow that, whether you're thinking swine flu, normal flu, follow that advice. But if you're struggling with your breathing, if your fever's really high so that you're not drinking, you're not passing urine, you're becoming more confused, short of breath, you must seek medical help.
I was on the tram here last week and it felt like everyone in the carriage was coughing and spluttering.
It does at the minute, doesn't it?
Is it particularly bad right now, or is it just autumn?
Well, I think winter is fast approaching, if not here, and we always see an uptick in these infections. People are mixing more indoors, there's less ventilation, people are more snotty, so it's being passed on surfaces and droplets in the air. It's always like this in winter, but I have to say, it does feel particularly worse this winter, but then I seem to say that every year. Yeah,
I wonder whether that's our immune systems all run down after COVID when we
Who knows? I think there's a lot of stress about, isn't there? And we know that stress dampens the immune system.
Does it?
Definitely. Cost of living, stress pressures and stresses of strains of life definitely dampens your immune system. Get some relaxation if you can. It's really hard at the minute, but that will boost your immunity.
You've just stressed us out even more. No, you haven't. That's been very reassuring.
Let's not mention the Christmas word.
You've reassured us. Thank you so much, Helen, for explaining that. It's really useful. Thanks.
I was already quite stressed.
You are, yeah.
I am.
You've got a lot to worry about.
Yeah. Thanks, John.
Right, it's 6:33. John's got the sport for us this